It started in 2020. She started losing function in her right hand. And at that point, we knew that something just wasn't right. And our pediatrician was amazing. She said, I referred you to neurology at Children's Hospital.
At neurology, Dr. Kameyer had taken a look and physically examined Piper and looked at me and said, as a father, I would have my child at the ER tomorrow and have an MRI taken.
When the ER doctors came in and asked, do you want Piper to be here? Do you want her to leave the room? We knew.
Then once they had the biopsy, all these signs point to Ewing sarcoma.
We put all of our trust into our care team.
So I think the day a parent receives the news that their child has a diagnosis of cancer is probably one of the hardest, most difficult days that any parent could ever imagine or have to endure. And I think what all parents are looking for at that moment is the best medical home that they can find for their child. And a medical home is more than just the physician. That encompasses all of what we can offer at Children's. We can offer state-of-the-art medical care in terms of great clinical care, but combined with medical research, combined with compassionate, empathetic care towards the family and to the child. We can also provide amazing social work support and psychological support to help the siblings, the child, and the parents through this very tough endeavor that they are facing. We all work together as a team, so the nurses, the nurse practitioners, the physicians, and every other member of the team work collaboratively to provide comprehensive care to your child during this really difficult time.
Anybody we came into contact with at Children's was knowledgeable, compassionate, was there to make you feel more comfortable.
You never felt like forced into what that next piece was going to be for care. What was always, hey, here's who I am. Let's talk, get to know each other. This is what we know. This is what a pathway is.
We had so much trust in our care team, and we would ask their opinion and they would tell us, and we said, let's do it, because we had so much faith that they were putting our best interests in the front, and as well as Piper's.
They're our family. Just no better way to say that than family.
Hi guys! How are you?
I cry when I think about Philly. I mean,
we feel so connected to Philly and everything that she did for us.
Here at Children's, your child is going to receive the best care because we're going to treat your child like they were our own. And what I mean by that is we are going to spend the hours needed to research and investigate the best treatment.
In the darkest time, the relationships are like the light for kids and for families of why you want to be there and why you feel safe and why it brings so much comfort. After Piper was diagnosed with Ewing sarcoma, our care team came in and spoke with us about this kind of roadmap, if you will, that laid out the best possible treatment plan for Piper based on all of the current research and what has been most effective for Ewing sarcoma, which is a rare cancer, and the uniqueness of where it was in her body.
Here at Children's, we practice multidisciplinary care for all of our patients. We do that so that we can provide the best evidence-based care, but also so that you get a panel of opinions for your child as they are facing their cancer battle. We have the opportunity to create a personalized treatment plan for every child that walks through the door. So sometimes that's standard chemotherapy that we know works and we know works great. But sometimes that involves a clinical trial or involves a new approach with radiation that may be novel that we can incorporate into their treatment plan. We are uniquely positioned here at Children's in that we are members of many of the collaborative research groups that exist throughout the United States that allow us to offer many different clinical trials that may be relevant to your child at any given time. And some of these trials are not available at other institutions and are based off of research done by our own providers, making them really unique and special to Children's Hospital Colorado. So here at Children's Hospital Colorado, we see a large volume of patients every year with a new diagnosis of cancer. Because we see so many patients, we as providers have developed specific care teams that allow us to focus on our areas of expertise. Therefore, your primary doctor, whether you have a solid tumor or a leukemia diagnosis, will focus specifically in that area. This also carries down to our surgeons, so that means that when your child needs to have surgery, that they will be operated on by somebody who does this all the time, which will improve the care and the outcome that they have. So in addition to caring for so many patients with new diagnoses, some of these are very common, and we'll see many of those each year. But many diagnoses are rare, and we receive those rare diagnoses because of the volume that we see, but also because people trust us to work up and evaluate these rare tumors to determine the best treatment plan. So rare is really not rare here anymore, that we develop a comfort level with everything that comes through our door to come up with the best plan for your child. I think when your child has a diagnosis that's potentially life-threatening, you want the best that you can get for your child. You want a hospital that's nationally recognized in both their clinical care, but also in their research, because without a strong research foundation, you can't offer cutting-edge clinical care. We are fortunate here at Children's to have world-renowned colleagues and leaders that are well-respected throughout our pediatric community to really be at the forefront of the care of pediatric patients and the medical research and changes that we're seeing that are going to improve the cure rates for our patients. So research has really been the crux of what's allowed us to do that. By having clinical trials and trying to either improve the cure rates or sometimes decrease the toxicity or long-term complications as a result of therapy, we have able to cure more patients and cure more patients with better quality of life. We will never be satisfied in our world until we're able to offer curative therapy to every patient that walks through the door. We know that some chemotherapy or surgeries or radiation treatments that we give can impact the fertility chances for a young adult. We have an amazing oncofertility team here, which brings in our surgeons and our gynecologist to have really strong multidisciplinary discussions with the family regarding potential fertility risk as a result of their therapy and potential interventions that we can offer that may preserve fertility in the future for their child. And I think these really offer families a nice opportunity for hope that at the end of all of this, that maybe their child can go on to be a parent just like they are and have the joys of parenting that we all hope our children can have if that's something they want in their life. So once we meet you and start to treat your child, we continue to follow those patients forever. We know that some of the therapy that we provide can have some long-term complications. So we have what's called our HOPE clinic, which is our survivorship clinic, which allows us to develop expertise in the care of our survivors and to help them with any potential complications that they encounter as a result of their therapy.
We're gonna go see Piper? Should we go see Piper?
7 months of treatment, which was at the end of June 2021, and she rang the warrior bell shortly after that.
Cancer-free. When I think of ringing the bell, Piper's dressed up in her Wonder Woman outfit that she wore the whole time, and she didn't have any hair at that point, and looks just this powerful, beautiful, strong girl walking down with Ralph at her side, her noble steed. We did it. I mean, it's like that ending scene of a movie.
It was just so inspiring to us as people, and so proud to be her parents and go through this journey with her.
She is that same spunky girl who loves the arts. She loves to get fancy and dress up and do things for other people and draw, and we see that, our little girl back. And
yeah, she's confident with just this new spark of life, and fights with her brother, and
normal.
loves to read and play in the yard, and she loves photography and taking pictures and documenting everything.
Mm-hmm. Everything that Piper went through in this whole experience, from start to finish, She has made that own choice within of, what do you want to be when you grow up? I want to be a pediatric oncologist. So I want to work at Children's and take care of kids. And I think when you see a 6-year-old using those terms and knowing that that's what she wants to be, it shows the impact that it made on her.